The World Health Organization has declared that a fast-spreading new variant of the highly infectious disease Mpox is a global health emergency. It's the second time in 2 years it's been declared as such. The continent's leading health body, the Africa Centres for Disease Control, had already warned it could spiral out of control unless measures are put in place to limit its spread. Here's the Director General of the WHO making the announcement.
Today, the emergency committee met and advised me that, in its view, the situation constitutes a public health emergency of international concern. I have accepted that advice.
Our health correspondent Dominic Hughes told us what the announcement from the World Health Organization means.
This is the highest level of alert, really, that the World Health Organization can declare. It's on a par with what they did during the COVID pandemic, for example. Viewers might think back to those rather troubling days. This follows hard on the heels of a similar declaration by Africa's Centre for Disease Control yesterday, which declared this a public health emergency that was continent-wide. Now, the World Health Organization's panel of experts has advised the Director General, as you were saying, that actually this is something that the international community really needs to be aware of. And what it is it's a call to arms, really, to try and mobilise not just medical resources, but political resources as well. So the WHO have said they're already on the ground, they are training staff, they are working on vaccines and treatments, they are in position on the ground, but really it's trying to mobilise resources, both financial, political, medical, to try and stop the spread of this virus. It's already, as you were saying in your introduction, it's endemic in the Democratic Republic of Congo, and the vast majority of cases so far this year have been in the DRC, but it's also spread to 15 other countries in Africa, and the concern is that it could spread beyond there too.
So the WHO will want, obviously, assistance from other countries. What does this mean for countries outside Africa as they consider what this might mean for them?
Well, it will mean that, for example, countries in Europe, for example, or the United States, in North and South America, they will ramp up their monitoring of cases. They'll be on extra high alert to see if any of these cases are present in their country. Because of the nature of Mpox, it can sometimes be look little bit like chickenpox, for example. When you have those blisters, it starts with sort of flu-like symptoms, but within 1 to 5 days, you can develop these blisters on the skin, and that can sometimes be mistaken for chickenpox. So testing and making sure that those cases are identified quickly will be happening, but also then there's this sort of marshalling of resources to try and get the international community to donate not just medical resources but money too, because the WHO says they've got a pot of about $13 million, but they clearly are going to need more than that if they're going to take serious action on the ground.